बिस्मिल्लाहिर्रहमानिर्रहीम नहमदुहु व नुसल्ली अला रसूलिल करीम। अस्सलामु अलैकुम class. In the last we have discussed the different derivatives of tetracycline and we have discussed that one. Now we are going to start the macrolides. The term macrolides was originally used for the antibiotics which are obtained from the species of Streptomyces. The first of this group was reported in 1950, that is Streptomycin. In 52, Erythromycin and Carbamazepine were reported. Currently, more than 40 such compounds are known which are isolated from the same species. All of these compounds are ended with thromycin, THROMYCIN, that is erythromycin, clarithromycin, azithromycin, roxithromycin. They have got good absorption, but they cannot cross the blood-brain barrier. Clarithromycin and azithromycin are absorbed better in the oral dosage form. These compounds or macrolide as a group is effective against gram-positive aerobes except Enterococcus. It is also effective against gram-negative aerobes but could not useful against Enterobacteriaceae. Macrolides as a class have got few characteristics, or they have got few specific requirements in their molecule. That is a substituted macrocyclic lactone ring, which can be known as a glycone, or aglycone, which may be a 12-membered, a 14-membered, or a 16-membered ring. Next one is the ketonic group, and the third one is an amino desoxy sugar that is termed as glycone. And some of the macrolides are neutral desoxy sugar which are glycosidically attached to the A-glyco ring is present. One of the examples is the gliadinose, which is present in the erythromycin. Briefly, we can say that macrolides exert their antibacterial effects by means of inhibiting its growth or bacteriostatic action. It inhibits the bacterial protein biosynthesis. They target 50S ribosomal unit. Different members inhibit protein synthesis at different stages of peptide chain elongation. The macrolide inhibit ribosomal peptidyl transferase. Repeating it, ribosomal peptidyl transferase activity. Some macrolides also inhibit the translocation of the ribosome along the mRNA template. Macrolides have got the bacteriostatic agent action, but erythromycin, maybe in higher concentration, can show its bactericidal activity, although the exact mechanism is still not known. But as a general rule, it is understood that they are going to bind with the 50S subunit of the bacterial 70S ribosomal RNA, or they are going to interfere with the protein synthesis, subsequently the structure function processes which are critical for the life of the bacteria, or their replication is going to be inhibited. Erythromycin interferes with amino acid translocation, preventing the transfer of the tRNA found at the A site of the ribosomal RNA complex to the P site of the ribosomal RNA complex. Without this translocation, the A site remains occupied, and thus the addition of an incoming tRNA and its attached amino acid to the nascent polypeptide chain is inhibited. This interferes with the production of functionally useful proteins, and this is the basis for their antimicrobial action. Erythromycin is unstable in acid medium. The C6 hydroxyl group reversibly attacks the C9 ketone, which result in a hemiketal intermediate. Dehydration prevents regeneration of the parent erythromycin, and the C12 hydroxyl group can subsequently add to produce a spiroketal species. The clandidose group is cleaved from the macrocycle, and more harsh conditions lead to the release of disosamine. Useful antibacterial activity lasts upon dehydration of the hemiketal, and the spiroketal is also weakly active. Or we can say that erythromycin is degraded by the acid, resulting in the production of spiroketal, disosamine, and cladinose. As a general class, these macrolides have got the motility receptor stimulation. They have got the allergic reactions like rashes. They have got the ototoxicity, also the cholestasis. We are going to discuss their interactions specifically with the erythromycin in the next slide. So, in the macrolide, erythromycin have got one of the most important place. Erythromycin, which is a macrolide antibiotic, have got antimicrobial spectrum, may be slightly wider than that of penicillin, and may be used in the patients who have got an allergy to penicillins, generally used in the cases of respiratory tract infections. It has better coverage of atypical organisms including mycoplasma and legionella, laginolosis. It was first marketed by Eli Lilly and it is today commonly known as EES, that is erythromycin ethyl succinate, an ester product or a succinyl salt of erythromycin that is commonly used parenterally, while the commercial product which is available is mainly erythromycin A, but it also have got erythromycin B, in which the hydroxyl group at the 12th position of the in which hydroxyl group at the 12th position of the A glycone is substituted. The amino sugar attached through a glycosidic linkage to C5 is disosamine. The tertiary amine of disosamine have a basic character to erythromycin, which is used for production of acid salts. The other carbohydrates linked to glycosides to C3 is called glycinose and is a unique sugar to erythromycin molecule. Erythromycin is produced from a strain of actinomycete, that is Saccharopolyspora erythraeum. I am repeating the erythromycin A, B and C. The erythromycin B and C can be termed as analogs of erythromycin. Erythromycin D have got a hydrogen at C12, which is replaced by the hydroxyl group in the erythromycin B. The B analog is more acid stable but has 80% activity of erythromycin A. The C analog differs from erythromycin A by the replacement of the methoxyl group on the glycinose moiety with a hydrogen atom. The C analog as active as erythromycin but is present in a very minute amount. Of erythromycin, the erythromycin stearate, like erythromycin itself, stearate is acid labile or acid sensitive. That's why it is available in a coated form to protect it from acid degradation in the GI environment or at the pH of the stomach. Next one is the erythromycin ethyl succinate, which we have also discussed that it was prepared by the Eli Lilly company. It is a mixed ester of erythromycin in which 2D-hydroxyl group of disosamine is esterified. Repeating it, it is a mixed ester of erythromycin in which 2-hydroxyl group of disosamine is esterified. It is also acid sensitive or acid labile Its absorption may be enhanced by the presence of food, or we can say that it is recommended to be taken with the food. This is another analog, that is erythromycin acetylate or lauryl sulfate salt of the 2-propionate ester of erythromycin. It is acid stable. Mind it, the former two analogs were not stable in the acid medium, but this is acid stable. But it has got some adverse effect, that is, it's got cholestatic hepatitis, and the more incidences is in the women than with other erythromycin preparations. This is the glucoheptonic acid salt of erythromycin. It is prepared for parenteral use. It is administered intravenously for the treatment of serious infections such as Degenerative disease, or when oral dose is not possible. This compound is a water-soluble salt and available as an amorphous powder that is freely soluble in water and alcohol. It is prepared for use parenterally after reconstitution in sterile water. It is administered intravenously to achieve higher plasma levels in the treatment of different infections. We have got different derivatives of erythromycin. There are a number of derivatives such as clarithromycin, azithromycin, roxithromycin, talithromycin, xanthomycin, spiramycin, ansamycin, olidiomycin, dicholine, drithromycin, drithromycin. But here we are going to discuss only few compounds. The first one is the clarithromycin. It is the 6-methyl ether of erythromycin. Simple methylation of the 6-hydroxyl group of erythromycin will result a semi-synthetic derivative. It is more acid stable, oral bioavailability, and reduced GI side effects. It is well absorbed following oral administration. It is more active against H. pylori, Moraxilla, Mycoplasma, Legionella. Azithromycin is another semi-synthetic derivative of erythromycin. It is a prototype of a series of nitrogen-containing 15-membered ring macrolides as azalides. It means the ring is expanded, and instead of 14 we have got 15-membered ring. Higher efficacy is decreased by taking the food. While we have seen that in the case of erythromycin, food increases the absorption, but here 50% absorption is going to be decreased. Improved pharmacokinetics, acid stability, and oral absorption, intracellular penetration, better gastric tolerability, and less drug interactions as compared to the erythromycin. At present, this azithromycin is also used as one of the drug in the regime for the treatment of COVID-19. The compound is used to prevent the secondary bacterial infection. Mind it, it is not antiviral, it is not an antiviral, but just it is used to prevent the secondary bacterial infection, and this was claimed by the different clinical reports or in the different clinical reports. Roxithromycin is another semi-synthetic antibiotic. It is used to treat respiratory tract, urinary, and soft tissue infections. It is also derived from erythromycin, containing the same 14-membered lactone ring. However, an N-oxime, capital M, dash oxime OXIME, an oxime side chain which is attached to the lactone ring. It is also currently used in clinical trials for the treatment of male pattern hair loss. In the start, we have discussed few adverse effects, including gastrointestinal disturbances such as diarrhea, nausea, abdominal pain, vomiting. These are very common in the case of erythromycin, as the compound is a motilin agonist. Erythromycin also have got side effects like arrhythmia and reversible deafness, but it is very rare. Allergic reactions also uncommon, but generally include from urticaria to anaphylaxis. Exposure to erythromycin, especially for a long course or long time at antimicrobial doses, can cross the placental barrier or through breastfeeding has been linked to increased probability of pyloric stenosis in young infants. Erythromycin acetylate in the beginning we have discussed that one, has been associated with reversible hepatotoxicity in pregnant women in the form of elevated serum glutamic oxaloacetic transaminase and is not recommended during pregnancy, while hepatotoxicity is also reported in other patients. It can also affect the central nervous system, causing psychotic reactions and nightmares, night sweats. It may also affect the combined oral contraceptive pills effectiveness. Erythromycin is an inhibitor of the cytochrome P450. It can be related to the interactions of the drug, which we have left in the beginning. It acts as an inhibitor of P450 systems, which means it can have a rapid effect on level of other drugs metabolized by this system. For example, warfarin. It inhibits CYP3A4 isoenzyme, and it is also contraindicated with simvastatin, that is Zocor, or lovastatin such as Mevacor, or atorvastatin such as Lipitor, because they are going to increase the interaction and increase the potential level of rhabdomyolysis. Another group of medicines or the drugs such as ergotamine and dihydroergotamine also have got adverse effects or contraindicated with this erythromycin. Hence, erythromycin should not be administered to people using these drugs or any drugs that is going to prolong the QT interval. Other examples of these drugs include terfenadine, acetaminophen, cisapride.